You have 14 days left before the deadliest shutdown that might lead to loss of lives. FCC doctors send warning to Wike. The Association of Resident Doctors (ARD) in the Federal Capital Territory has vowed to go on the deadliest shutdown of hospitals in 14 days' time if outstanding demands are not met. Wahala. Wike, I don't understand why this man is refusing to pay these people. Doctors, you should pay them their money on time. They are saving lives. Now, if they shut down hospitals now, what do you think is going to happen to the patients inside the hospital? Because I don't understand this person. Now, they're giving you 14 days. At least 14 days is enough for you. Because you are giving people 2 weeks to pay money for their C of O or whatever, so that you will not revoke their land. So if they are giving you 14 days, that is enough for you to meet their demands. These people, are they asking for too much? No, they are not. The president of the association, Dr. George Ebong, issued the warning on Monday during a press conference at the Wuse District Hospital, Abuja. Ebong warned the minister of the FCT, some Wike, that there is an urgent need to focus on the well-being of doctors. Yes, if they're Japan, you say they are running outside of the country. Meanwhile, they are not being treated well in their own country. Doctors outside the country, do you know, the stress is much to be a doctor. These people, sometimes they don't go home for weeks taking care of patients. They leave their family, they come to work because they are passionate about it, and yet you will not treat them well. You will not pay them well. I don't understand. Who are on the verge of extinction due to economic hardship. Praising Wike for his infrastructural projects in Abuja, he urged him to also pay the same attention to human development. Yes, you should pay attention to human development, especially doctors, nurses, and no. They deserve teachers. Pay them their salaries. They deserve it. They worked for it. I don't understand though. Ebong noted that the FCC minister has 14 days to act on the demands to avert what he described as the deadliest shutdown of hospitals in the nation's capital. He said, first, we have to appreciate the minister for his infrastructural development in the FCT since its emergence. We want him to know that doctors is an abandoned project. While he fixes the infrastructural abandoned project, we are the human abandoned project. We believe the minister can deal with the challenge. We want the minister to clear 6 months of salary. Can you imagine? 6 months? That is really unfair now. Pay them their money now. They are working for this thing. They are working, saving lives every day. And yet you are owing them salary. It's not fair. It is not fair. That is why everybody is running outside of the country, because they rather go to a place where they are treated well. They are seen for their hard work that they are doing. 6 months, a whole 6 months. Mr. Minister, please do the needful. We want the minister to clear 6 months of salary arrears owed to our members employed in 2023. The minister should with urgency clear the payment of the medical residency training funds of 2024. Also, we want the minister to review the bonding policy to 2 years instead of 6 years. Other demands are: we want the minister to enforce the implementation of skipping and issuance of skipping letters to our members employed in 2023. Immediate payment of accoutrement allowance for 2024, payment of ongoing 13-month hazard allowance area, and the FCCA management should fast-track conversion of ARD FCCA Post 2 members to consultants and expedite the process of employment of healthcare workers to buffer the manpower shortage in the nation's capital hospital. I don't think they've asked for too much with the way people are spending money lavishly in Abuja. Traveling here and there, doing this and that. Doctors, pay them what they want and give them everything that they have asked for. They are not asking for too much. I don't think they are asking for too much. This injustice is alien to FCT. If this is allowed to continue, the nation's health sector will collapse. We want the minister to solve the problem so doctors can practice to the best of their ability. Yes. A happy life. They work well. If they are being paid their salary, well, of course they'll be happy to go to work. But you not pay me for 6 months and you want me to go and treat patients. They'll even treat the patients with anger. That is why Nigerian nurses, doctors, they are always angry. Because you did not pay them their salary now. We earlier gave a 21-day ultimatum last week during our annual general meeting, leaving 14 days. We don't want the deadliest shutdown that may lead to loss of lives. It is important that the minister listens and acts on demand without delay. He begged out because I don't understand. I do not understand though. People are very wicked in this country. John Adiko says, I trust Wike, my good leader. He will pay you people. He will pay them. They gave him 21 days, the remaining 14 days. And he will pay them. He better pay them more. Pay them because these people, they are working for it. 6 months. How can you be owing 6 months salary? What's happen? Jonathan Ezekiel says, Wike, as a matter of urgency, you need to respond to doctors' demand and not only to judges. Abiyo, help us tell him. Pay them their money. Eugene Okafor says, I am pleading with the doctors to reconsider their step, as they should bear in mind that it is the poor people that will suffer for it. All our politicians are blood-sucking demons who derive joy in the death of the poor. Less for them. They'll even close the whole hospital in Nigeria so that people will be dying in thousands daily because it gives them joy. Yes, so I think they derive joy in seeing people dying in the country. They derive a whole lot of joy there. But really, you can't tell these people to keep being patient for almost 6 months. So how do you expect them to take care of their families, take care of their loved ones? They have to do what they have to do. So we are the ones that should be begging Wike to pay them their salary so that they will not go on total shutdown. Because why would you not pay them their money? What's happen? Ibrahim Hawa says, Wike is working. Working where? I wonder. Demolishing people's houses. Building road. I don't know the road that he's fixing. Please pay them their money, I beg. Hassan Olalekan says, are you people the only doctor in Nigeria? Is there no doctor in other states in Nigeria? Why is only in SCT? This hatred of Wike is getting too much. Abba, you don't know what you are saying. So they will just hate on Wike and say they are going to shut down the hospitals. You don't have sense. You don't have sense. So because I hate Wike, I'll now say I'm going to shut down hospitals and less people die. You don't have sense, so you do not. Andrew Izakpa says, what of your minister? Doesn't he has a role to play in the matter? Which minister? It is the way people reason in this country. Emmanuel Osekita says, surely the way our doctors in Nigeria treat human beings are not encouraging. Doctors will have to pay attention, value the lives of people in Nigeria. They stand at the back of not treating patients when they are on strike. This is not so in a civilized country. Nothing is bad, asking or fighting for your rights. But it's not by using not attending to a dying patient or patient that needs attention as a shield. And what do you not expect them to do? I'm not saying that, oh yes, it's okay for them to abandon patients, but how do you want them to fight? What do you want them to do? At least they've been warned in 21 days now. It's remaining 14 days. Have they said anything? Have they even said, oh, okay, we've heard you. We've heard your plight. We're going to do something about it. They'll not even say anything, as if they heard what you even said in the first place. So what do you want them to do? 6 months. A whole 6 months. That's too much now. My listeners, over to you. Leave your thoughts in the comment section. Don't forget to like, to share, and subscribe. Thank you for listening. See you some other time. Bye.